with the amount of noise regarding government spending, national debt, DOGE, and the capping or cutting of Medicaid benefits in 2026, I wanted to highlight a video talking about both Medicare and Medicaid funding. I think it's interesting to see where these programs are funded, the mechanics behind the funding, and get into a little bit of the details, because obviously it is a large spend every year that goes into Medicare in particular. So Medicare and Medicaid are both government-funded healthcare programs in the U.S., and they are funded and administrated differently. Medicare is a federal program that provides healthcare coverage primarily for individuals aged 65 and older, as well as some younger individuals with disabilities. It's mainly funded through employees and employers, each paying 1.45% of wages for Medicare, equals 2.9% in total. Self-employed individuals pay 2.9% just themselves through SECA. And then high income earners pay an additional 0.9% Medicare surcharge on earnings over $200,000 for the individual or $250,000 married filing jointly. They also are funded by, this is Medicare, funded by general revenue, the federal budget. Congress allocates funds from income taxes and other federal revenue sources. Medicare premiums and beneficiary payments, this is interesting. Part B, the medical insurance of Medicare, and Part D, the prescription drug coverage, are funded by monthly premiums paid by the enrollees. So that is not covered by the government. Part A, hospital insurance, is mostly covered by payroll taxes, but may require deductibles and co-payments. That is interesting to me. Medicaid funding, Medicaid again, completely administered differently. Medicaid provides healthcare for low-income individuals and families, and it is jointly funded by the Fed and state. Federal government contributions, the Federal Medical Assistance Program determines how much the federal government contributes to each state's Medicaid costs. The Federal Medical Assistance Program varies by state. It's based on income levels and ranges from 50 to 78%. The poorer states get more funding. The federal government covers 90% of the costs of the Medicaid expansion enrollees under the Affordable Care Act. For state contributions, the state covers the remainder of the Medicaid costs, about 10%. Each state decides eligibility rules, benefits, and payment rules within the federal guidelines. So it's up to the state, but the feds have to sign off on it. States fund their share of the 10% costs through state taxes, such as general state revenues, income or sales taxes, provider taxes, such as fees on hospitals or healthcare providers, and tobacco, alcohol, and lottery revenues in some cases. Again, each state's a little bit different. But in summary, comparing the two, for Medicare, administered by the federal government, funded by payroll taxes, premiums, and general revenue, and the state's role is limited with Medicare, only supplemental in some cases. Medicaid is a joint federal and state program. It is funded by federal and state revenues, and the majority is a state design program and shared costs. So a lot to digest there. As you guys know, we're going to make a blog on this as well. But I think it's really important when we talk about government spending, knowing the government doesn't actually produce any products or generate any income themselves. These are the individuals and projects that are funding these programs. So really interesting stuff. Comment down below what you guys want to learn more about, and I hope you have a great Wednesday.